We are indeed very much a fan, or also a promoter, an advocate for the recognition and representation of all sectors within the field on UN level, on EU level, on African Union level, etc. We see a lot of good examples, such as the European Union has the Civil Society Forum on Drugs. The African Union has also the African Union Civil Society on Drugs, and we hope to see. Of course, the UNODC also has the Vienna NGOC, but what would I think be even more of a positive experience if we can institutionalize this CND into more of also an open meeting between UN and civil society. I do want to commend the UN for doing already a great job, and the representatives of the UN, they often join webinars or trainings, or are always open to meet with civil society, but having a constructive mechanism in the UN where we can exchange information, updates, what is going on in the world, what is going on in our localities, etc., so that we can even utilize maybe the CND to make something constructive in that sense.
From a communications perspective, what narratives or framings have you found most effective in shifting public and political opinion away from punitive approaches and towards health and rights-based responses?
Yes, this is a very simple answer almost, but of course the implementation is not simple, but it's all about the language. We find it very important that the language should not stigmatize, the language should recognize, should not victimize either. But it should be also very clear what the goals are and how to support a person, but also making sure that we translate the needs of that person without victimizing it, but being very clear on an institutional level what needs to be changed. So for example, when we talk about prevention, you need to be very clear about what kind of prevention do we need in order to make it a positive experience and a positive development of a human being. At the same time, we also consider, for example, the promotion of the alternatives for incarceration very important, because we do not want drug users to be punished for their use.
And recording. So, in your work with WFAD, how can civil society use intersectional approaches to strengthen the continuum of care from prevention to recovery, rather than working in isolated silos?
Thank you for the question. At WFAD, we always focus on that specifically to make sure that we don't only advocate for the fact that we need to make sure that we don't work in isolation when it comes to prevention, harm reduction, treatment, or recovery, or even social integration. But it also something that we try to translate to our members as well as in projects. So when it comes to our members, we try to do capacity strengthening training, creating network events, encourage them to exchange information, exchange best practices, webinars, etc. But we also try to implement projects, for example. So we had a project last year in Kenya where we explicitly focused on combining the two segments of prevention and treatment, making sure that organizations learned about each other's speciality, let's say, and making sure that they connect and that they continue working together, so that we can make sure that everyone is met at the stage where they're at, rather than that an organization is not able to help a person because they might not be knowledgeable about treatment, because we know it's very complicated to know all of it, of the spectrum. So it's very important to be connected and to be able to refer a person to the right service. So